Bangladesh is witnessing a worrying surge in suspected measles cases, with nearly 5,800 infections reported worldwide. Hospitals across several districts are struggling to cope as children remain the worst affected, many requiring urgent treatment and isolation care. Well, health authorities warn that the outbreak is escalating rapidly, with hundreds of new patients being admitted daily. Well, let us understand about its impact on children and mortality. Notably, the outbreak has tragically claimed the lives of at least 130 children in the past 6 weeks, including 113 suspected deaths and 17 confirmed fatalities, primarily among children aged 6 months to 5 years. Halimur Rashid, director at the Communicable Disease Control, highlighted that compared to the previous years, both the number of affected children and the death toll have increased significantly. Now, let us shed light on the historical context of measles in Bangladesh. Notably, measles has long been a threat in Bangladesh, with the highest number of suspected cases on record reaching 25,934 in 2005, according to the World Health Organization data. Numbers had declined steadily in subsequent years until this recent surge. Health officials attribute the current outbreak to multiple factors, including vaccine shortages, delayed immunization, campaigns, and logistical challenges in reaching vulnerable populations. Now, let us understand about the vaccination gaps and delays in Bangladesh. Bangladesh had made significant progress in its vaccination program, but a planned measles vaccination drive in June 2024 was postponed following a deadly uprising that led to political instability. Most of the children received their first measles vaccine at 9 months, yet many of those affected in the current outbreak were only 6 months old, leaving them highly vulnerable. Mahmudur Rahman, chief of the National Verification Committee of Measles and Rubella, admitted that the country failed to meet its target of reducing measles cases to zero by December 2025, citing poor vaccination coverage as a key reason. Public health expert Tajul Islam Ebari added that although funds had been allocated for vaccines, procurement delays have directly contributed to the current crisis. Now, let us understand about the government response and vaccination drive. Well, in response to the outbreak, the Bangladeshi government has launched an emergency measles rubella vaccination campaign. The initiative aims to immunize more than 1.3 million children aged 6 months to under 5 years, initially targeting 30 upazilas in 18 high-risk districts, particularly in northern Bangladesh. Health Minister Sardar Shakawat Hossain Bakul confirmed that healthcare workers have been deployed across the affected regions and that the campaign will first cover the worst-hit areas before expanding nationwide. Dr. A.N.M., a public health specialist, emphasized that timely immunization is critical in order to prevent further deaths, especially in densely populated areas with limited healthcare access. Now, let us shed light on the measles risk and global perspective. Notably, measles is one of the world's most contagious viral diseases transmitted through coughing and sneezing. While it can affect people of all the ages, it is particularly dangerous for young children, causing severe complications such as pneumonia and breathing difficulties. Globally, the World Health Organization estimates that 95,000 children die from measles each year, mostly in countries where vaccination coverage is low. What is the call to action that Bangladesh should use and can approach? Notably, authorities are urging all the parents and guardians to bring their children to designated vaccination centers immediately, stressing that timely immunization remains the most effective way to halt the outbreak and save lives. Bangladesh healthcare system continues to face immense pressure as the country fights to contain this deadly surge of measles cases. That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.